Welcome everybody. Thank you very much for joining us this evening for our frequently asked questions session from parents with babies or toddlers on a cow's milk or soya-free diet. And we have three expert specialists here today to talk about the subject, and I'd let them introduce themselves, starting with Alison Booth.
Hello, my name is Alison Booth and I'm a community paediatric dietitian working in the community in Somerset, and I currently work for Somerset Partnership NHS Trust.
I'm Jenny Langlands. I'm one of the specialty doctors with an interest in allergy in paediatrics at Taunton and Somerset NHS Foundation Trust.
I'm Heidi Sieber. I'm a specialist paediatric dietitian at Taunton and Somerset NHS Foundation Trust.
Wonderful. Thank you very much, everybody. And we're going to let everybody know about some handouts that we will attach to the website where you've accessed this webinar from. And we've got several useful handouts that you can use. We've got the BSACI Food Allergy Parent Guide handout and some IMAP Milk Allergy Guideline initial fact sheet for parents, and an IMAP the Early Home Reintroduction to confirm the diagnosis of cow's milk allergy, IMAP Milk Ladder and associated recipes, and IMAP guidelines also available from Allergy UK website. And I think we're considering putting a guideline for the reintroduction of soya as well. Is that correct, Alison?
Yes, that's right.
Fantastic. Okay, on to the questions. And these are questions that have been collated over time that parents have asked. And to start with the first question, why did it take so long for my baby to be diagnosed with milk protein allergy? And I'd like to pass that over to Jenny, if I could.
Yeah. This is a tricky one, and the reasons for it is that we find that a lot of the symptoms are very non-specific. And we hear things that babies might be described as being a sicky baby, that they've got frequent vomiting, they can be a bit irritable, they're only settled when they're being held. And also sometimes just things like loose stools, but these are symptoms that we see in normal newborns, and so it can take a bit of time for us to just tease things out to find out whether there may be actually something else going on. Often the symptoms will mimic reflux. It's very common in babies. We see, again, frequent vomiting, and again, that's those symptoms of needing to be held upright, won't settle. And so we tend to look at whether there's any intervention that might help with the reflux first of all, and we have to just make sure that we've ruled that out before making a diagnosis of a milk allergy, because I think you want to make sure that you got the right diagnosis and you're not causing any harm to the baby by giving them any medication that would be unnecessary. And just thinking about if you're going to be changing milks, you want to make sure you're doing it for exactly the right reasons.
Okay, that's really interesting, and I think that will help a lot of parents because it can be frustrating, I think, can't it, when you've got a baby that's unwell.
And the thing is, it's time, like a 24-hour period with a baby who's unsettled, irritable, colicky. It's really hard, and I think that you think that something needs done and you want it quickly, and we'll often say, well, we'll see how it goes, and it can be quite frustrating.
Absolutely, but it is, as you said, very important that you get the correct diagnosis.
That's right. I'm really keen that not to exclude things from babies' diets early on, and I just feel that we sometimes it does take a bit of time for us to unpick these things.
And of course, taking some of these foods out, particularly something like milk, is a major source of nutrition for these children. So you're compromising their potential growth if you take it out unnecessarily.
That's right, and absolutely, and it's getting the right one. And then we might find that you're chopping and changing, and then it's giving the baby a length of time on that milk before you then decide that you're going to change to the next one, because often you'll find yourself spending a fortune on milks that, you know, it's unnecessary.
Yeah, absolutely. Okay, moving on to the next question. That was great, thank you. What hospital tests are available to find out if my child has a milk allergy? And again, I'd like to pass that one over to Jenny if I can.
There's no specific test for the delayed cow's milk protein allergy, so that's the non-IgA mediated. Unless a baby presents with symptoms suggestive of an immediate allergy, such as the IgA-mediated reaction, and those are things such as that hives, that sort of nettle rash effect that often seen around the mouth. Often it can be lip swelling or just even facial redness. And if a baby sees something like that, and often I'll find the history will be in that somebody's given even the baby a kiss on the cheek, and then where they've had that kiss, they can sometimes come out with a rash around that area. Then I would want that baby referred for a skin prick test to look at whether they have got a reaction to cow's milk on that. Unfortunately, the only test that we can do to exclude milk or dairy products from the baby's diet. And then we're going to re-challenge, and that again takes time, and we're looking around 4 weeks before we would then re-challenge. So it's not a quick fix, but it's the only way that we can really know whether the milk is causing.
So are we saying that for an immediate type of allergy, so what is termed an IgE allergy, there would be tests available for that?
That's
so the
right,
baby with
absolutely.
the very quick reaction on the face when being kissed might well show up on an IgE test.
That's right, and that's the baby that I would like to see in clinic, that I would perform a skin prick test and to see whether it, and again, though the skin prick test isn't absolute, I can use it as a guide. Sometimes blood tests can be performed, but I tend to go for the skin prick test as it's a very quick and a visual response.
You can get an answer in 10 minutes.
That's right, exactly, to sending off a blood test.
Absolutely.
And then I can often use that as a marker to decide how the allergy it's resolving, or when we can use the skin prick test in that way. But that really is the only test as such that we've got.
And that's not suitable, correct me if I'm wrong, for those with non-IG allergy. And I think this is where a lot of confusion comes in. So a lot of people call non-IG allergy an intolerance, when actually it's not. It's still an allergy.
Right.
It's just an allergy that uses a different part of the immune system and won't show up on tests. So that's a very frustrating position to be in, isn't it?
Because you want to the word allergy and intolerance can cause such a confusion, because if someone comes to me and says they've got a cow's milk allergy, then I've got to determine, do they mean that that's an immediate reaction or is it a delayed reaction? And so it's only by taking a clinical history am I going to be able to differentiate between the two. And if it is the immediate, that IgA mediated response, then that would be when I would offer the skin prick test. However, otherwise, it can be quite a frustrating time, because you want to know answers. You've got a baby who's unsettled, colicky. You're so worried about them that you want somebody to come in and be able to give you answers, and then to come along to clinic and be told, well, there's no test that we can do that. It's very hard.
And knowing that your only solution to diagnosis for those non-IG babies is taking the food out, seeing if they get better, and presumably challenging them at an appropriate time if you feel it's safe to challenge them, and seeing if the symptoms come back again.
That's right.
So really that's your diagnosis on like a test.
Yeah.
And with milk intolerance, are we talking about things like lactose intolerance, which is to do with the sugar and not anything to do with allergy?
and so looking at lactose intolerance, that is actually very rare. But it is something that's widely talked about in the community. But again, I would be very cautious on advising anybody to go on to a non-lactose,
a low lactose formula.
Yes,
because that for an allergy baby that wouldn't be suitable, would
Absolutely not. That's right. Yeah.
Okay, that's great. Very interesting. Thank you very much. Moving on to the next question. I'm exclusively breastfeeding my baby and his symptoms have improved significantly on a milk-free diet. Do I also need to avoid soya? And I'd like to pass that one over to Heidi, specialist dietitian, if we could.
So we know that about 30 to 50% of babies that are allergic to cow's milk may also have a reaction to soya. But it's important that you only exclude soya from your diet if you feel that your baby's symptoms have not resolved completely while being milk-free. It's important that any restriction whilst breastfeeding is based on the baby's symptoms and tolerance.
Okay, and a soya-free diet, what sort of formulas are they going to use if they can't have a normal formula and a soya-free? Are there lots of formulas they can choose from?
Absolutely.
Okay, plenty to choose from.
Yes.
And I find it really interesting, this soya and milk allergy cross-reactivity, isn't it? It sort of seems that there is a high proportion of these children with milk allergy who will cross-react with soya as well. And I gather that's because one of the proteins in the milk is very similar to one of the proteins in the soya, and the body literally mistakes it for a milk protein. Is that what you understand from that cross-reactivity?
Yeah, I think it's not fully understood the exact pathways as to why some children react to both milk and soya, but it's thought that there are certain proteins that are very similar, that some babies will kind of react to them in the same way that they do milk. But it's important that it's not all babies that are dairy allergic will react to soya.
Okay.
So it's only about 30 to 50%, and we'd only want to exclude soya if the baby was still showing symptoms despite being fully milk-free and showing symptoms when they had soya within their diet.
Because actually soy formula is very palatable, isn't it? So if you can use that, it would be a much better one to be able to use if you can, I guess.
For some of the older babies, yeah.
Okay, that's lovely, thank you. Why is specialist formula generally stopped at 12 months? And I'd like to pass that one over to Alison, if I could.
When children are over 12 months, milk becomes a much less important part of their diet. And what we often find is that where children are drinking too much formula, it often means that they're often eating a lot less solid food as well. For children who are not reacting to milk, at 12 months, they're actually able to move on to full-fat cow's milk as a drink. And therefore, from 12 months, for children who are reacting to milk, then they are generally fine to go on to an over-the-counter fortified calcium fortified milk substitute. And there are lots available now, many more than there were even as short a time ago as 18 months. And we generally would recommend that over 12 months, children would move over onto the Alpro Soya growing up milk. It's got a cartoon giraffe on the back. Or they could also go on to one of the oat-based milks, so something like Oatly Barista or Oatly Whole. There are some others around now as well. Marks and Spencer's do one, Asda do one. It's just important to recognise that some of them are a little bit lower in calories and protein than others. So it's trying to choose the ones that are higher calories, higher protein. Generally, most of them have got the same calcium content. And over 12 months, I would generally recommend a maximum of about 14 ounces of milk substitute to drink a day. So for example, they could have 7 ounces in the morning and then another 7 ounces at night. And if you want to, they can have additional, but that would be generally added to cereal or maybe in cooking. And I'd also recommend that over 12 months, you take the bottle away and you give it to your child in a non-valved cup. And it's just another point there, if your toddler's got if they're not gaining weight as well as expected, that they would be referred to be reviewed by a dietitian. So that's quite important as well.
No, that's great. Very comprehensive answer. My baby's father has anaphylactic reaction to peanuts. Should I delay introduction of nuts into my baby's diet? Can I pass that one over to you, Jenny?
Yeah. I find this one a hard one because the level of anxiety that will be in the family is going to be quite large. If you've experienced an anaphylactic reaction, you're going to be pretty wary of having peanuts in the house. However, there is evidence now that early introduction of peanut is actually beneficial and can have a protective element to allowing that child to grow up without a peanut allergy. So it's a bit of a double-edged, this one. So unless your child has a very severe eczema, I would not delay the introduction of peanut in the diet. I think there's a lot of controversy about that because in the past we used to delay nuts. You know, the story was not to give nuts into the diet, and some people wouldn't give it until 5. And I think really the reasons behind that were to do with concern regarding choking as opposed to nuts. And there was a bit of, that sort of uncertainty about how we used to think that by delaying things we might actually improve stop the risk of them having a reaction. However, that evidence is now not there.
And it's interesting, the evidence has really turned that whole philosophy on its head, hasn't it? And said, actually, we need to introduce relatively early.
And so it's difficult to change a culture as well, because we've grown up, or advice you might get from other elder family members is not to do it, and so then you're completely changing tack. So
certainly when my babies were small, it was very much don't introduce nuts. So what sort of age should you be introducing nuts now?
It can be as young as 4 to 6 months, but that's generally I would probably say after 6 months. And the other thing is, I used to think, well, how am I actually going to do that?
Yeah.
Do you know? And it's actually like I actually want almost written guidance to how do I actually get the nuts into the diet, and then peanut butter. Do you know, just a small amount of peanut butter, and that will help.
Yeah, and of course you can keep that quite away from the other person in the household, can't you? It's not like you've got handfuls of nuts hanging around.
And that's it, because then you think, well, if you can't have it in the house, well, where's the safe place to do it? Whereas you don't want to stop your child and then run the risk of them having an allergy.
And I think you're right, it's that anxiety around if you've got somebody who's anaphylactic in the house.
Absolutely.
But you know it's going to help your baby to introduce them early, so they're less likely to have to put up with that.
Yeah, so it's a difficult one, but the evidence now is to introduce peanut early. However, I would say if there is a history of severe eczema or another food allergy, then I would ask for medical professional advice before proceeding to introduce nuts.
Okay, that sounds very sensible. And we've got a guideline from the food allergy group. Have we got a parent's guideline on that?
That's right. Yeah.
Excellent.
Yeah.
Thank you. My child still reacts to dairy and or soya at 1 year of age. What should I do?
So we know that most children with a dairy and soya allergy will outgrow them between the ages of 1 and 3. So usually in the toddler years,
so by the time they get to primary school, they're quite often.
To primary school, there's very few that will still be allergic to milk and soya at that point. So it's suggested that around the age of 1 year, you would re-challenge dairy and soya separately into the diet using a milk ladder or soya ladder. And you would challenge your child at a year. If that's not tolerated, or the child still shows symptoms of an allergy to milk or soya, you would continue to challenge every 3 months until the allergy has resolved.
Okay.
If it is tolerated and you are fully able to move your child through the milk ladder or soya ladder, then you can continue to allow your child to have dairy or soya in normal quantities.
And of course, this presumably is really aimed at children who are non-IgE, so they don't have the dangerous form of allergy. So if you've got any history of anaphylaxis or breathing issues associated with the allergy, would you recommend home challenge like this?
No, so it would be very much under the guidance of the health professional and what skin prick test results are showing. And so it would be very much guided by the medical professional that you're under.
But the general rule would be if you've got IgE allergy, the more dangerous form, you shouldn't do home challenge. Okay, that's great. And it should be more challenged in a hospital environment instead.
Yes.
Okay.
Yeah,
that's great.
And I think if you get partially through the ladder for milk or soya and symptoms return, then the child can continue to have the amount of dairy or soya that they've tolerated up to that point in their diet, and then we would look at recommencing the ladder in 3 months' time, and again continuing that every 3 months until the ladder's completed and soya and dairy is fully tolerated in the diet.
So you're sort of building up a tolerance level by doing that, I guess. You're sort of saying the baby is tolerant to this stage of the ladder and keep that in.
Absolutely.
Because I get the impression from the research coming out that actually if you tolerate a certain amount, you should keep it in 2 or 3 times a week, would you say?
Absolutely, yeah. It's important
to keep that level of tolerance
on a regular basis.
Okay, so
to build that tolerance.
At least a couple of times a week, keep that tolerance in, and then your tolerance might develop further down the ladder. You'll be able to tolerate more and more of that food in time.
Yeah, which is why it's recommended that you continue kind of the ladder every 3 months until things are fully resolved.
That makes sense. So actually you can develop further and further tolerance. It's not a case of overnight you suddenly go from no tolerance at all to total tolerance necessarily. It could be that you just develop
there will be some children that at a year things will have fully resolved and they'll be able to move through the ladder for milk or soya in kind of very quickly in one episode. There'll be other children whose tolerance will build up over time, and so it may take several attempts every 3 months at doing the milk ladder before things fully resolve. So it does depend on the individual child.
So once they've gone through the whole ladder, and let's say they tolerate it absolutely fine, they're tolerating dairy completely now, so that's fantastic. I get the impression, correct me if I'm wrong, it's very important, not just when you're going through the ladder, but once you finish the ladder, that you do keep that food in regularly to keep that tolerance long term through your life.
Absolutely, yeah. It's important they would have those foods on a regular basis in their diet.
Okay, that's fantastic. Thank you very much. Are any of my future babies likely to have dairy and or soya allergy? I'd like to pass that over to both Alison and Heidi.
Okay. Thank you. So it is possible that any subsequent children may have a milk allergy, but it's not always the case. So it's not something that we would presume at all, and it's really important. So if you're breastfeeding, really important, and when you're expecting, that you don't avoid anything from your diet, including milk. And when you deliver your baby, aim to breastfeed as long as possible, aiming for at least 6 months of age. So there's not an awful lot that you can do in order to avoid your baby having a milk allergy, but really eat everything in your diet that you would normally eat and aim to breastfeed for as long as possible.
So that's interesting, because the old sort of thinking many moons ago was that you could perhaps change the chance of them having allergy by taking the milk out of your own diet, for instance, and that's not the case now. It's like, no, just keep everything as normal in your diet.
Yes,
okay,
absolutely.
That's great. And breastfeed as long as possible if you can.
Absolutely.
Okay,
yes.
That's great. Any comments you want to add to that, Heidi, at all?
No, I think it's important that children are only have dairy excluded from their diet when they're showing clear symptoms related to milk allergy. So as Alison said, I think it's important that kind of milk stays in the diet.
And there was some talk about using something called a partially hydrolyzed formula, wasn't there, at one point, for babies that might be at risk of developing atopy? And do I gather the guidelines don't necessarily suggest that's necessary now?
Yes, so there's been a recent paper, 2019, that has suggested that those formulas, the partially hydrolyzed formulas, are not particularly helpful. So that's not something that we would generally recommend.
Okay, great. Thank you very much. So just to reiterate, we've gone through the questions today, and I'm sure there are lots and lots of other questions you'd like to ask. We've got other webinars coming up shortly as well, which will go into more details about different aspects of cow's milk and soya-free diet. So please keep your eye out open for those. And thank you for listening. And thank you very much to each of our specialists here today. Thank you, Jenny and Heidi and Alison. It's been a really informative session. And do contact our Twitter account at Patient Webinars as well, and there's our website at the bottom, all NHS specialists running these webinars. So please do clock in and see what else we've got on our website. Thank you very much for listening. Goodbye.